for coming here on the last session of the day. Burak Açıkel. I am from Sami Ulus Gynecology Illnesses Department. I'm going to be talking about oxytocin. Well, it has been mentioned in detail. That's why I don't want to give you too much information. We know synthesis and segregation actually. The social stimulus increases, and after segregation, to cope against stress and in order to regulate emotions, it is an important hormone, and it is also segregated in the brain system, and after surpassing the brain blood barrier in the periphery and in the vicinity, we see the efficacy of it. And we know that the stressful stimulus do increase oxytocin serotonin levels, and also this increase. I mean, if we encounter a stressful event, the serum oxytocin level increases, and this actually protects us against stress, and it also enables us to regulate our emotions. And with breastfeeding females, when we compare it with non-breastfeeding females, the cortisol levels are lower, and breastfeeding women, in terms of stress regulation, it has an important role, oxytocin. And it has an inhibition efficacy over amygdala, and oxytocin administration with a functional MRI, we see that amygdala activity decreases. So, briefly to say, we can say that oxytocin protects us against the stressful effects, and during stress it increases the segregation. About emotional disorders and depression, how can we associate it? The adolescent brain here, of course, during adolescency, psychologically, physically, and the central nervous system continues to develop, and the brain maturation continues really fast. The hormonal stress responses are more sensitive amongst adolescents, which can increase the sensitivity. In adolescents, the depression that we see is closely related with stress, because with adolescents, it's the stress actually is directly related with the emergence of depression. And when there is a study conducted amongst adolescents and adults, 80% of the depressive attacks do emerge after a stressful event. Especially during adolescence, these stressful life events actually do trigger the emergence of depressive symptoms. So both directly and HPX and a rewarding system, it contributes to depression. And these three circles can impact each other. There is a meta-analysis, which is a large-scale one. It evaluates the depressive adolescents and the control group, DST. There is a significant difference. I mean, the HPX with steroids, it cannot be suppressed. In the patient group, the basal cortisol level is higher. The Symposium, there isn't a significant difference. So, in brief, yes, during adolescence, stress is an important factor, and oxytocin is an important tool in order to regulate stress mechanisms. The segregation increases, and it regulates. Well, the mood trials, mostly they were carried out with rats, animals, and this is depression modeling actually. Intracerebral vascular oxytocin was administered. And when an antidepressant is used, oxytocin is impactful. With human studies, just like in many biochemical parameters, there are studies who find oxytocin low or else high. There are 3 studies: plasma oxytocin level, Frenchmark et al., and Marmark et al., and Soy et al. The depression group compared to control group, the plasma oxytocin level is lower. Soy et al. In terms of bipolar, there is an adult study that I carry out, but in childhood and adolescent period, even in the depression group, there are not many studies. These are mostly adult studies. High-level plasma oxytocin levels. There are studies that find it higher to control group. Kararowski et al. And Parker et al. Reveal the outcomes. Of course, between 2 groups, there are no differences according to certain studies. Well, mostly the perinatal period is where they focus during trials, because during breastfeeding it increases oxytocin and attachment also increases. And the oxytocin and depressive symptoms, they have a contra-relation. So if the oxytocin level is high, the depressive symptoms are low. April et al. Have carried out a study with 127 pregnant women, and also Zebran et al. They have also carried out, and Kunz et al. They have also carried out studies with pregnant women. With all studies, actually, as the oxytocin increases, the depressive symptom decreases, and attachment also increases. In our age group, the childhood and adolescent age group, there is, and I had done a keyword research, and I had found 67 documents as a result. Just like Amit mentioned, there is a increased serum level of oxytocin in treatment-resistant depression in adolescents group. I think that this study also, between control group and patient group, actually, they tried to find a difference, but they couldn't find a difference that much. But in the therapy-resistant group, it was higher. Therapy-resistant depression adult 10, and depression 27 adults, and healthy control group 25. Well, mostly the plasma oxytocin levels were high in the ones that were resistant to therapy compared to control group. Especially, Soy et al. Have carried out a bipolar study. They have made a reference to that. In terms of bipolar depression, could this be a marker? Because this group is risky in terms of bipolarity. In the treated resistant group, actually, compared to the, the oxytocin levels were higher. Well, the question is this: in terms of major depression compared to control group, the adult research shows that oxytocin levels are high. Well, on the other hand, the oxytocin levels, maybe there is a resistance. In order to maybe treat depression, the serum level increases, but it doesn't show any efficacy. And in the adult age group, oxytocin receptor polymorphism was evaluated with 92 participants. And oxytocin, whereas 22542898 heterozygote mutated individuals in the early periods, if they have a negative parent relation, anxiety and depression is seen more. If an adult in the early period, if they have negative parent relations experience, and if they have this heterozygote mutation, then they have more tendency to have mood disorders. So, what could be the takeaway message? Depression-oxytocin relation is complicated actually, and it is not only one way. In the adult literature, actually, this is indicated. In the childhood and adolescent patient group, the number of studies is lower, and it is also difficult to research on it. Well, we can clearly say that it is closely related with the stress system, and in childhood and adolescence, especially major depression, can also be triggered with depression. It is really difficult to work on oxytocin because the measurement area is different, and the tube, and while taking blood, the stress factor there, and also having different levels throughout the day actually, it makes these studies more difficult. In the adult literature is not the only measurement. Maybe frequent continuous infusions should be done with blood sampling, but it is maybe difficult to work with our age group, especially genetic studies in the major depression group. I think that more studies should be carried out because there are many unknowns in this field, and the etiologic relation could be explained more. Thank you very much for listening to me.